prostate, benign prostatic enlargement and symptoms. This is the first in a series of short videos to explain what benign prostatic enlargement, or BPE, is, what symptoms it can cause, and the different treatments available. The prostate is part of the male reproductive system. It is found just below the bladder and in front of the rectum. It surrounds the urethra, the tubes that men pass urine and ejaculate through. In younger men, the prostate is about the size of a walnut, and its main job is to make a fluid that mixes with sperm to make semen. The prostate also produces a protein called prostate-specific antigen, or PSA. This protein makes the semen more watery. It is very common for the prostate to grow and get larger as men age, particularly in men over the age of 50. It isn't known exactly what causes the prostate to grow, but the male sex hormones, like testosterone, may be a factor. This growth is known as benign prostatic enlargement, BPE, or benign prostatic hyperplasia, BPH. The word benign means the condition is not cancerous. The size of the prostate does not always correlate with the severity of symptoms. Some men with small prostates have significant symptoms, and others with large prostates are not troubled by them. Around half of men over the age of 50 have BPE. However, not all of them will have symptoms. Benign enlargement of the prostate can lead to the urethra, water pipe, being squeezed or partially blocked, causing urinary symptoms. When symptoms occur due to this blocking, or obstruction, it is called bladder outflow obstruction and results in symptoms such as reduced flow of urine. Hesitancy. This means you have difficulty starting to urinate. Terminal dribbling. Towards the end of urinating, you may find the flow dribble slowly. Incomplete emptying. A sensation that the bladder is not emptying after urinating. Retention of urine. This is the inability to pass urine. Less common is overflow incontinence. New onset of leaking urine either during the day or night. Men can also experience overactivity of the bladder, which can lead to increasing frequency, passing urine more often. Or nocturia, getting up at night after going to sleep to pass urine. Urgency, when there's a strong desire to pass urine. Or urge incontinence, a very strong urge to pass urine that results in leakage of urine before getting to the toilet. Men can experience mostly obstructive symptoms, symptoms of overactivity, or a combination of both. Many men visit their doctor when they experience these symptoms. Different treatments are available for the different symptoms, so it is important to discuss your symptoms carefully with your doctor. While both prostate cancer and enlarged prostate are conditions that affect the prostate, they are very different conditions. However, symptoms can be similar. So if you develop urinary symptoms, it is important to check for prostate cancer. Often these will be due to benign or non-cancerous changes in the prostate. BPE usually starts in the central area of the prostate around the urethra. Prostate cancer more commonly develops in the periphery or edge of the prostate and typically doesn't cause symptoms in its early stages. Having an enlarged prostate does not mean you're more likely to develop prostate cancer. There is a lot of information available online, such as these websites. If you are concerned about any symptoms, you should discuss these with your GP.